Alright, so we're going to go ahead and do trach suctioning today. So I would do all my normal procedures, and I'm going to go ahead and bring my stuff in with me. I'll just set it down. So knock, knock, knock. Hi, I'm Shay. I'm going to be your nurse today. And people with trachs, they probably can't talk. So you're going to do a lot of verbal cues. You'll go ahead and get your 2 identifications. Alice Wonderland, awesome. And your birthday is 02/22/2003. Perfect. And they would go ahead and nod their head so you know that you have the right patient. So you want to go ahead and put them in semi-Fowler's or high Fowler's position. So I'll go ahead and do that. Okay, that's probably good. So then I would wash my hands and provide privacy. And if they've, obviously if they have a trach, they know what suctioning is. So we'll provide privacy here. And we'll go ahead and get everything set up. So the very first thing that I want to do is turn on the suction. And that's with the doctor's, their doctor's orders about where the suction should be set. I'll go ahead and get this all set up right here. And then if they were on oxygen, I would go ahead and, because we're going to hyperoxygenate them for at least a minute before we start the procedure, and then 30 seconds in between each suctioning. So if they were already on oxygen, I would want to go ahead and do it 4 or 5 liters above their already oxygen flow. If they weren't on oxygen at all, I would just do 4 or 5 liter flow. So we can go ahead and we can set it right there, and that can just kind of do that again for a minute before I start doing this. So all that set up, I can go ahead and put this down so we have a little bit more working space. And this is a sterile procedure, so I don't want to turn my back to anything. I want to keep it in my field of vision. So we'll go ahead here and open up our kit. And this doesn't have the box. Usually the box is on the outside, so you can kind of dump that box out. So I'm just not doing it the right way here to show you. It should be out here, and you would shake the box off right there. Then you could go ahead and use that little perimeter right there and slide that up. You can go ahead and open this up right here, and you have that 1-inch perimeter that you can stay in until you hit the sterile fill. So we'll go ahead and get that to stay open. I would go ahead and get my dominant hand and put it on the inside of the glove. And I can step away, because if I drop my glove, I have to start all the way over. So go ahead and only touching the inside of the glove. You want to go ahead and put your gloves on. So I'm going to go ahead and keep this sterile glove not reaching over my sterile field. I'd want to come around right here and grab this box. Then, this is a brand new one, so it's kind of stiff. I would go ahead and come around so I'm not going over my sterile field, and staying in that 1-inch border, I would go ahead and place that little box right there. Then I'd come with my hand that is not sterile, take off the lid, and this whole time I'm keeping my sterile field in my vision, and I'm keeping my hands above my waist. So I would come around my sterile field right here and dump some of this saline in this box right here. But before I did that, I would want to go ahead and dump out the top. I would want to make sure and dump it out first, so then I have a really clean saline to put in there. Go ahead and put the lid back on. then you would come in, and I can go ahead and put my other glove on, reaching in the cuff. I will step away again and put this glove on. Okay, now I have both gloves on. I can go ahead and use both of them to open this up. And I can just go ahead and dispose of that. Now I want to go ahead and wrap this up in my hand, and this is a tiny one. I'm wondering if this is for a peds patient. Anyway, so I would again double check my suctioning, make sure that it's on the right thing. And I'm going to keep this hand sterile, and this hand now becomes unsterile because I'm going to go ahead and hook it up to the suction. Before I did that, I would want to go ahead and move down my oxygen right there. You can either take it completely off or you can just leave it right there so it has a little bit of suctioning. So I'm going to go ahead and keep this hand to do the suctioning and this hand to actually put it inside. So you would then come in without touching anything else. You would begin to place the tubing in there, and you keep going until it hits the bifurcation. And you only want to suction for 10 seconds. So I would go in there, and you kind of want to twist it around, pull it out, and as you're doing this, you're suctioning with this hand. Bring it out. Come into your saline. Again, on and off suctioning so it cleans out the tube. And you can do this about 3 times. But really this whole procedure is to obviously clear out anything that could possibly get into their lungs. So do it until it's all clear. If you were to do it more than 3 times, you would want to go ahead and do the oxygen in between. So again, we'd come over here, cleaning it, and this will be the 3rd time until we hit that spot again, twisting it around. Perfect. Okay, so at this point, then I would go ahead and assess the lung sounds, so all the normal lung sounds that we did. With my stethoscope, I would do, just their overall respiratory status, make sure everything is good. If I'm hearing anything, then that probably means that there's still more to suction. So I'm just assessing everything to do with their breathing, making sure all the breath sounds are normal. If everything was normal, I would go ahead and start my ending procedures, cleaning up all my equipment. So I could go ahead and wrap this up in my glove here, the tube, and I would do it in a red biohazard bag. Go ahead and throw that in a red biohazard bag. I could come and throw this away. Throw this away. Awesome, everything's clean. I want to wash my hands again. Then I would go ahead and kind of just turn the suction off. I would take off the hyperoxygenation, and if they had oxygen, I would put it back on. If they didn't, I would just go ahead and take it all the way off and back over there. I would make sure that they were okay. Go ahead and put this side rail back up, kind of move everything back where it was. Make sure that they were okay. Give them their call light, lower them down to the lowest position, make sure that they're comfortable. And then the last thing I would do is go ahead and document all of my findings in detail, making sure that I'm doing a really good job at all my charting. And that is how you suction.